Hello everyone, now let us discuss about 2023 E&M changes for office or other outpatient consultations. Now let us discuss about consultations. What is a consultation? A consultation is a type of E&M service provided at the request of another physician or qualified healthcare professional or appropriate source to recommend care for a specific condition or a problem. A physician or other qualified healthcare professional consultant may initiate the diagnostic or therapeutic services at the same or subsequent visit. And a consultation initiated by a patient or a family member are not requested by physician, other qualified healthcare professional or other appropriate source. For example, non-clinical social worker, educator, lawyer or insurance company. They are not considered as consultation codes. In simple words, any consultation initiated by the patient himself or the family member and that is not requested by a physician or other qualified healthcare professional or other appropriate source. For example, it can be a non-clinical social worker, educator, lawyer or insurance company. In these cases, they are not considered as consultation codes. You need to quote consultation only when it is requested by other physician or qualified healthcare professional or other appropriate source, not the patient, not the family member or friend. And the consultant's opinion and other services and any services that were ordered or performed must also be communicated by a written report to the requesting physician or other qualified healthcare professional or other appropriate source. The opinion and any services that were ordered or performed must be communicated with a written report. This is important in consultations. And one important point is if a consultation is mandated, we need to employ modifier 32 should also be reported. Modifier 32 indicates mandated services. If the consultation is mandated by a third party payer, then modifier 32 should also be reported. And to report services when a patient is admitted to hospital inpatient or observation status or for a nursing facility in the course of an encounter in another setting, we need to refer the initial hospital inpatient or observation care or initial nursing care facility that we will discuss when we talk about that particular topic. Now coming to office or other outpatient consultations. The consultations are mainly of two types, office or other outpatient consultations and the next is inpatient consultations. So now we'll discuss about office or other outpatient consultations. Now, the following codes may be used to report consultations that are provided in the office or other outpatient sites, including the home or residence or emergency department. There are no specific codes for new and established patient. The consultation codes are category 992422, 99245. And the follow-up visits in the consultant's office or other outpatient facilities that are initiated by the consultant or patient. The initial consultation visit should be reported with 9924 series, 2422, 245. But the follow-up visits in the consultant office or other outpatient facility that are initiated by the consultant or patient are reported using the appropriate established patient codes that come under the category 99222, 99215. This is for outpatient established patient codes. Or home or residence established codes are 993472, 99350. This we will discuss when we talk about those particular topics. As of now, the initial visit will be coded with consultation codes and the follow-up visits will be coded with established patient codes. It can be outpatient or it can be office or home or residence. And you need to code the respective codes depending upon the location. And the services that constitute transfer of care, that is, are provided for the management of the patient's entire care or for the care of specific condition or problem, are reported with appropriate new or established codes for office or other outpatient visits or home or residence services. Follow-up visits are coded with respective established patient codes, whereas transfer of care are also reported with appropriate new or established patient codes for office or other outpatient visits. And for an outpatient consultation requiring prolonged services, we need to see the code 99417 that is covered under prolonged services. And one important note in the consultation codes is 99241 has been deleted. Previously it was there. Now to report 99241 we must see 99242. Now here are the list of codes, office or other outpatient consultations. They come under the category 99242 to 245. So 99242. This requires medically appropriate history and physical examination with straightforward medical decision making. Previously, one more code was there, 99241, that has been deleted as effective from 2023. 99241 is deleted. There are only 4 consultation codes, consultation outpatient codes. 99242, which requires straightforward medical decision making, and the code selection is purely based on medical decision making. And 99243 requires low MDM. 99244 requires moderate MDM, which is nothing but medical decision making, and 99245 requires high MDM. All the codes, they require medically appropriate history and physical examination, but the code selection is purely based on medical decision making. Straightforward for 99242, low for 99243, moderate for 99244, and high for 99245. Now, the first code 99242. For a new or established patient, this is a consultation code. For a new or established patient which requires a medically appropriate history and or examination and a straightforward medical decision making. And whenever time is considered, when using total time on the date of encounter for code selection, it requires 20 minutes must be met or exceeded. In order to code 99242, 20 minutes must be met or exceeded. Now let us see the examples for 99242. The first one is office consultation with 58-year-old male referred for follow-up of creatinine level and evaluation of obstructive urotherapy that was relieved 2 months ago. Here, the patient is just coming for the follow-up of creatinine level and the obstructive urotherapy was relieved 2 months ago. So here the MDM is just straightforward. So you can code 99242. One more example is office consultation for a 45-year-old male requested by his internist with asymptomatic torus palentinus requiring no further treatment. This is just for a consultation of asymptomatic condition, and this also requires a straightforward MDM. So you can go for 99242. Next, coming to 99243. This code must be given for new or established patient which requires a medically appropriate history and or examination and a low level of MDM. 243, the requirement is low MDM. And whenever time is used as a governing factor, 30 minutes must be met or exceeded. If the code selection should be based on 30 minutes. In order to report 99243, minimum of 30 minutes must be met or exceeded. Now let us discuss the examples for 99243. The first one is initial office consultation for 60-year-old male with avascular necrosis of the left femoral head, and the pain scale is 5 to 7, and the physician prescribes painkillers and orders a hip x-ray. This comes under low level of medical decision making. So you can code 99243. The next example is office consultation for a 31-year-old female complaining of palpitations and chest pain. This is a new condition which is undiagnosed and the physician orders ECG. So this goes to low level of severity and hence you can quote 99243. Now coming to 99244, for a new or established patient which requires a medically appropriate history and or examination and a moderate level of MDM. Here for 99244, it is moderate level of MDM and whenever time is considered as the governing factor, 40 minutes must be met or exceeded. Now let us see examples for 99244. Initial office consultation for a 65-year-old female with moderate dementia, mild unsteadiness. Here the severity level of dementia is moderate. Mild unsteadiness, back pain and fatigue on ambulation, intermittent urinary incontinence. These are so many symptoms or conditions that must be diagnosed and the physician orders workup for dementia and urinary incontinence. So this goes to moderate level of complexity. So 99244 can be coded for this particular scenario. Next example is initial office consultation for a 33-year-old female referred by endocrinologist with amenorrhea and galactorrhea. And the endocrinologist is suspecting pituitary tumor. So workup for the evaluation of pituitary tumor has been ordered. So this also leads to moderate level of MDM. In two cases you can code 99244. Now coming to 99245. This can be coded for a new or established patient which requires a medically appropriate history or examination and a high level of medical decision making. MDM must be of high complexity, high level of MDM. And whenever time is used as the governing factor, 55 minutes must be met or exceeded. One important point is for services 70 minutes or longer, you need to use prolonged services code 99417. Whenever the services are rendered at 70 minutes or longer, you need to use prolonged service code which is given by 99417. This we'll discuss when we talk about prolonged services. As of now, in order to code 99245, the minimum time should be 55 minutes or more than that. Now coming to example for 99245. The first one is office consultation for a 58-year-old male with a history of myocardial infarction and congestive heart failure. Here the patient is already having two life-threatening conditions who complains of the recent onset of resta angina, shortness of breath and left-sided weakness. So there might be exacerbation of the chronic condition. And the patient has a blood pressure of 160 by 90 mmHg and is a class 4 heart failure patient, which is a significant risk of mortality. So this comes under high level of MDM. And in order to monitor if the patient has been admitted to inpatient, you can clearly code 99245 for this consultation visit. Next example, emergency room consultation for a 1-year-old with a 3-day history of fever and increasing respiratory distress. Here the condition is worsening, who is thought to have a cardiac tamponade by the ER physician. And in this case also, the patient is immediately sent for observation for further monitoring. So both cases, they can be considered as high level of MDM and can be coded 99245. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.